Why sometimes we have guests on this show that just make me feel like I have not tried anything in my 40 odd years. This gentleman graduated the Manning School with, listen to this, 22 CSEC Cape distinctions. Did you hear what I just said? Not subject, just like past them, distinctions. And since 2015, possibly before, he's been passionate about advancing local medical research. Governor General Awardee, data science student, Dr. Elumbe Calvert. He has a name that sounds like he's destined for greatness. He joins us to talk about his mission in the medical field. So great to meet you. Good morning.
Thank you so much for having me.
So at 26 years old, you are a senior house officer at the University of the West Indies. True?
Yes.
Which means you've just completed your internship year and now you're trying to figure out what you want to specialize in. Elumbe, at 16, you lost your home.
Yes.
Burnt to the ground.
Mm-hmm.
That didn't stop you.
It did not.
That motivated you.
Definitely.
You always knew you wanted to do medicine?
So I always knew I wanted to do medicine. I've always been very interested in studying the human body and understanding the science behind it. And also I love connecting with people on a deeper level and hearing their stories. And I felt like medicine was a good mashup of both areas. So I'm able to learn about the disease conditions affecting patients and understanding what they're going through and advocating on their behalf in terms of their receiving proper health care and access.
So talk it through now. When you walk into the hospital room, right, and say, hi, I'm Dr. Calvert, what do the patients say?
So very minimally sometimes they'll say, oh, you're very young, but I guess due to my approach, I've never been, not been able to care for a patient because I looked very young. So.
Nobody says, call the real doctor, please, because this young man.
Definitely not.
Wow, so that's a lot to achieve at such a young age.
Yes.
But you're not finished yet.
No.
Because you're off to Harvard in August.
Yes, I am.
What's happening at Harvard?
So at Harvard, I'll be pursuing a postdoctoral master's in biomedical informatics. And
Because what? In English? A joke.
So
postdoctoral master's
in biomedical informatics. So I gained admission based on my medical experience, being a medical doctor, and also having a lot of data science experience due to my master's I'm currently completing at the University of the West Indies. So it's based.
So you're a doctor.
Yes.
Currently doing a master's.
Yes.
However, in August, you're going to be doing another master's.
Yes.
Because one master's is just not enough. You have to serve many. So you're going for another one, okay? And this one is in
medical informatics.
Because you're driven, you're passionate about data and the link between data and healthcare.
Yes.
Okay.
So, so being a medical doctor and treating patients, I realized that we see them and we collect all this data on them and then they get discharged and nothing really comes of that data. And we have this large style of data that's just hidden away in these paper dockets that I feel like can be used to advance medical care and access to health to patients. So having understand that, I pursued the master's in data science at UWI. That has given me a better understanding of how we can use data in different domains, especially in my domain, which is healthcare. And through that, I decided to embark on a journey of going abroad to kind of understand how they're using data in the medical system so as to advance care.
How do you do all of this at one time?
It has been hard, but I have good support systems from my friends, parents. I have very understanding seniors. I must pick up Dr. Brewster from the Department of Community Health and Psychiatry also. And just sheer will, to be honest.
Sheer will.
And motivation.
Yeah, if you don't have that, you don't have nothing. Yes. So you come back here, you're going to try and apply what you've learned in this master's.
Most definitely.
But very interestingly, you are more heavily erring on the side of research science than on practicing, which I find to be interesting. And in terms of practicing, you're looking at dermatology.
Yes, the best field ever. It is the best field. I think it's very overlooked. People say, oh, you're just applying creams and steroids to skin, but I feel it's a very, very complex area, and there's a lot to learn and a lot of research that can be done to advance care and understand these disease processes.
Okay, and the truth is that when your skin looks good, and your mind is right, and when your mind is right, your body is good. So there's an inextricable link between everything. Boy, you are such an impressive young man. It's so nice to meet you this morning. We wish you all the best when you head off in August.
Thank you so much.
Dr. Calvert is his name. If you see him at the UWI, he knows exactly what he's doing. No, after all, he's a senior health officer, Governor General Awardee, data science student, medical doctor, master student, research scientist. There are so many other things we could add, but this young man is destined for some big. When you see him in 10 years getting these huge international, local and international awards, remember you saw him here on Smile Jamaica. And such a cool head.
Thank you.
Very impressive. All right, more on Smile and return from Studio B. Second edition of News in 5 is next.